Welcome to The Health Line, issues that shape our well-being. I'm your host, Dr. Andrea Alt-Brutus. In The Health Line, we provide engaging and informative content on the factors that shape our health and well-being, along with innovative insights that help us gain a better understanding of our ever-evolving, complex healthcare system. Today, I'm very excited to have back Larry Levy on The Health Line. Larry is the Executive Dean of the National Center for Suburban Studies at Hofstra University. Larry has spent 35 years as a reporter prior to coming to Hofstra, editorial writer, columnist, and PBS host. Larry has won countless top awards for journalism, including being a Pulitzer finalist for in-depth work on suburban politics, education, taxation, housing, healthcare, you name it. During the election season, we saw Larry all over the place. He was on the news, he was in print. I believe you were in print also, right?
I was in so often this year that I was starting to get sick of hearing myself talk, to be perfectly honest.
Well, we didn't, and we really appreciated your great insight into the 2024 presidential election. So now we're on the other side, so we're happy to have you back here to talk about what's next, what's on the horizon for us as Americans now that Trump has won the election. So welcome back to the Health Line.
Thank you for having me back.
So, as I mentioned, Trump has won the election.
Yes.
And over the past few weeks, he's come out with a number of picks for top positions in his administration. And since we're here at the Health Line, we're all about health. And we've been keeping an eye on, well, who are his top picks for health? One major person who's getting a lot of attention is RFK Jr. And he has been tapped to be the lead for the Department of Health and Human Services. And just to give my audience some information about the Department of Health and Human Services, it oversees a workforce of more than 80,000 people with a $1.7 trillion budget. And within the Department of Health and Human Services, we have the Centers for Medicare and Medicaid Services, which Trump has nominated Dr. Oz to lead that. You have the Children's Health Insurance Program, otherwise known as CHIP. You have the Food and Drug Administration, the FDA. You have the Centers for Disease Control and Prevention, CDC. You have the National Institutes of Health and a number of other agencies that focus on childhood education, mental health, substance abuse, you name it. So with that said, this is a major behemoth of an agency that Trump has picked RFK Jr. to be the lead of. Right. So what are your thoughts about
Let me back up a second before we get to RFK and provide a little context. Trump did win the election. There's no question about that. But there's also the question of what did the election mean? What was the public saying when it voted for him or did not vote for Kamala Harris? If you look at the numbers that the Democrats actually picked up an additional seat in Congress, that they lost, quote unquote, only 3 or 4 Senate seats at a time they were defending 25. If you look at 4 or was it 5 governorships that the Democrats won in states that Trump also won, there's a real question about how big a mandate he has in general to go in whatever direction he wants to, as far and as fast, and on what issues. So one could argue that it is a limited mandate if it's a mandate at all. And when it comes to health care, with the exception of reproductive rights, abortion, there was almost no discussion in terms of issues that would fall under the huge umbrella of health care. So that brings us to RFK. Now, it clearly, and I think any even Trump supporter would say that he is a political appointee, and not in the traditional sense that everybody who holds a non-union, non-civil service job is a political appointee, but he was appointed primarily because of the political support that he gave to the president, taking himself out of the election and not siphoning votes away from Trump in states where it might have made a difference. He also stood for certain things that Trump's supporters have some passion on in the area of vaccinations. But it is clearly that he has never run a major agency or a major business. It's not like taking somebody who ran General Motors and say, you know what, great manager, deals with billions of dollars of budgets, complex systems. I think I want to apply that to the health and human services field. He probably ran a small environmental law firm, the Riverkeepers, which at one time did a lot of great work for the Hudson River Cleanup Act. So he's clearly not somebody who's been hired for his administrative acumen and experience. Mm-hmm. The other thing to keep in mind, and I think that the Trump White House and the people around him who have influence understand, is that RFK, no matter what he thinks, will never be allowed to go beyond what the administration feels the public is going to tolerate. Now, how they define the public is different than maybe somebody else might define the public. If he gets too far beyond his own supporters, the MAGA people in one way or another, if he gets too far ahead of the Republican governors, which will bring us in a second to the Affordable Care Act, if he gets too far out in front of the industries, the businesses that are heavy contributors and supporters of Trump and the Republican Party, he is not going to be allowed to go there. So there's a limited amount of tolerance. People talk about the lack of guardrails now, that Congress is Republican, White House is Republican, that the Supreme Court is Republican. And where are the guardrails? Where are going to stop them from the Republicans, from doing anything they want? Well, there are all kinds of guardrails that are not in the Constitution. There are lobbyists for major industries that are going to exert tremendous influence. And if it doesn't succeed in moving the White House toward or away from something, there are 20 or so members of Congress, Republican members of Congress, who have been elected in districts that go back and forth between Republicans and Democrats, who won seats that Kamala Harris and Joe Biden won. If they want to remain in office, they have to be really worried about being perceived as extremists. And these swing communities are almost all suburban. If I could put in a little plug for why I make a living here. I run the National Center for Suburban Studies. And these swing districts, the 30 or 35 in the country, most of them are wholly or substantially suburban. They may have plenty of red MAGA people and deep blue progressives, but there's a preponderance of those purple people, the people in the middle. Those are the folks who will determine whether these Republican members get elected 2 years from now, when Trump's not on the ballot. So again, they are going to be, to some degree, persuadable when it comes to tampering with the issues that people really do care about. Medicare, for example. Trump has said, I'm not touching Medicare. I'll try to make it better. I'll try to make it more affordable. You know, whatever he'll say whatever, like a lot of politicians. He'll say whatever he needs to say to get the AARP off its back and to get other organizations that have a vested interest in Medicare. He may take some shots at Medicaid, because in the Republican dogma, Medicaid is a wasteful project because it provides funds for people who should be working but aren't. You know, it's part of that whole idea, you know, lazy people need the government handout. Nothing could be further from the truth. And there's also arguably a racial element in it. The perception in MAGA world that this is a program for Black people and Latinos, when most of the people who get Medicaid funds are white and most of them are elderly. You know, they're your grandma. You know, they're a white person's grandma is getting the help for and disabled people. So I think that even Medicaid, they're going to go carefully, because there are a ton of vested interests who may have supported Trump and would say, wait, that's not why we voted for you. We didn't vote for you to do that. The unfortunate thing for Trump's supporters, just like it was the unfortunate thing for Obama supporters and Bill Clinton supporters, is that for some reason, presidents seem to forget why they got elected. They seem to ignore just how small a mandate or a majority they won by, and go off doing things that make voters feel exactly that. Like, for example, Bill Clinton was elected on, it's the economy's stupid. And what's the first thing he does? He takes on health care.
Yeah, exactly.
Didn't do it very well. It was much too complicated. I've interviewed Hillary Clinton a number of times since then, and she said the lesson she learned was to enroll in the school of smaller steps, right? Trump will have to, if he wants to succeed or he doesn't want to lose his majority in Congress in 2 years, is going to have to be careful with all these issues that maybe his supporters would love to see him go wild on. I know that was the expression Trump used with regards to RFK,
Exactly.
back to RFK.
Exactly.
I'm going to let him go wild.
Yes.
Well, I don't think he's going to let him go wild if he starts getting calls from lobbyists and other interest groups, particularly those who are supportive of him, to say, hey, that's a bridge too far to try to sell us.
That's a great segue to focusing on, well, what is RFK for and what is he against? And some of the things are, controversial, but some of the things people are actually liking it.
I don't know that it matters.
Okay.
I think what matters is what Donald Trump and the closest advisors think. I'm not sure that he's going to pay a lot of attention to these more kind of symbolic or figurehead type appointees who have no experience in these fields, who don't even know the players and don't have their finger on the pulse of what might, be possible politically as well as policy-wise. I think too much is being made of RFK. He's certainly having a chilling effect, or certainly causing a lot of sleepless nights among researchers who are afraid that the work they are doing on vaccine will be subordinated. I think there's a lot of fear about things that people ought to worry about and make sure that they pay attention to proposals and are prepared, if they have to go to the handful of Republicans in Congress who could be counted on to oppose a Trump proposal. But I think there's a real limit to what he's going to be able to do.
Yeah.
I just do.
You mentioned about how there are public health officials and public health organizations like the American Public Health Association that have issued statements where they express their worry about having someone like RFK Jr. in charge. And, yes, he's definitely made some controversial statements about vaccines and about perhaps removing fluoride.
And they're not necessarily even popular with Trump supporters. Yeah. There was a recent poll, that showed 90% of Republicans find Trump favorable and support him. 60% found RFK favorable. Now, 60% is not bad in these days when politicians tend to be unpopular, but there's a heck of a delta there between 90% and 60%. So there's a lot of people in MAGA world who have their doubts about RFK for a variety of reasons.
Yeah. And to talk about some of the things that people do like about RFK Jr.
Sure.
Some people actually are interested in hearing his thoughts about how to make our food supply more healthy in the United States, how to remove toxic chemicals from our food supply, focusing more on diet and exercising and about managing chronic diseases. Right. He has some good qualities.
Well, here's an irony that may be bitter, but the same guardrails outside of Congress and courts that we used to count on that may keep Trump and the administration and people like RFK from going wild, as we say, also may keep him from dealing with stuff that there's a consensus ought to be dealt with. Because there are industry forces that are going to want to maintain processed food, that are going to want to keep sugar subsidies. There's an awful lot of support for an awful lot of policies, some arguably good for us and some not so good for us. And the same forces will have an effect in both directions. So this may be depressing what I'm saying, because you could take away that nothing really good or bad is going to happen. And that's a frustration, because when the bad isn't dealt with, it overwhelms the damage that the good can ameliorate. So that's the problem here.
Okay.
That there's more potential damage in working against vaccine development and distribution than you're going to gain by limiting processed foods over the next year or so.
Yeah.
At least that's my unformed, undoctor opinion.
That's why you're here, to give us your opinion. Moving on from RFK Jr., what dominated the talk prior to the election was reproductive rights and abortion, like you mentioned earlier. And it seems that it's fallen off the radar because of attention that's being given more to RFK Jr. or Dr. Oz or any of the other picks that Trump has made over the last few weeks. So what do you think is going to happen with abortion and reproductive rights going into 2025?
There will be a cadre of Republicans that will push for the national abortion ban, even though Trump said he's not going to sign it. Trump will not discourage them from doing that because it revs up an important portion of his base, but he will do almost anything he can to keep it from actually coming to his desk for a signature. And there's a lot of layers, a lot of territory between somebody proposing something and giving speeches when there's nobody in the chamber in Congress and actually delivering a signed bill, because there are still a lot of those moderate Republicans who don't want to go anywhere near that. And there were messages sent. There were, I think, 7 or 8 states where there were measures on the ballot. Most of them passed, including in some really red states. And Florida, where it didn't pass, you got almost 59% of the people voted for it. And if it wasn't for some clever political trick of forcing a 60% vote to pass the Florida measure that would have protected abortion rights, it would have been 7 out of 8. So, and even if you kind of get in the weeds a little bit, Trump carried Missouri by 18 points. And the measure passed by almost as much.
Interesting.
So, these are people who voted for Trump and voted for abortion rights. You can say anything you want about Donald Trump. He's not stupid. His instincts politically are strong, regardless of how he applies them, whether you like them or not. And he's not going to ignore a message like that. But the problem's not going to go away. There still are, what do you do if you're an advocate or just a person with a conscience about all those women and their families in states where, the gestational restrictions are virtually impossible. I think you'll also see Republicans, conservative caucus in Congress, go after drugs being distributed across state lines. They'll try to limit the use of the various so-called abortion pills like that. You'll see that happen. And you'll see within the states, there'll be, efforts to make things more restrictive and less restrictive. The Democrats made it their major issue, democracy and abortion. Neither one made it, or at least their standard bearer was not able to sell it. I think it would be wrong to say the outcome shows that it's not an issue people care about politically, and there certainly has been damage done to the ability, whatever you care, damage done to the ability of women to make decisions about their own body. Whether you feel they should or shouldn't, they clearly have lost that ability. So abortion will still be with us as a political issue. Certainly it will be with us as a policy issue. And you'll hear it come up in congressional debate. The attitude of Democrats is, bring it on. The more you guys talk about taking abortion rights, the better off that we are, So, it will not disappear from our radar.
Okay. And speaking of another major health policy issue, and debating whether it disappeared or not, is the ACA. It didn't get a lot of attention leading up to the election. And if you recall in the debate, Trump said he has a concept of a plan. I think it was either in the debate or one of the interviews I think he did. So what happens with the ACA going forward?
It was not a major issue at all during the campaign. Trump realized a couple things. One is that it wasn't the issue that was going to get him elected. It was the economy, it was immigration, and it was crime, and the gap between the perception and arguable reality on all of those. And he did what he could to keep that gap as wide as he could. Healthcare was an issue that people cared about, but primarily on the cost side of it, which fed into the economic and inflation argument. And something else has happened besides why people voted this time around. More and more Republican governors came to realize that the Affordable Care Act was a gift for their constituents, therefore their popularity, and for their budgets. And they, by embracing it, were able to provide a higher level of care for less money, not only for their constituents, but for their own budget, and will be really loath to allow anybody to make it harder for them to deliver the care, or if they decide politically or from their conscience that they need to deliver it, that they have to pay for it out of tax dollars. So there's probably a critical mass of Republicans who do not want any significant changes. So if Trump, quote unquote, goes after it, it'll be all smoke and mirrors. It'll be renaming it. It'll be calling this, moving something around, but the changes won't be fundamental, except when it comes to the subsidies. You know, that's a whole different basket of issues that Republicans can be rallied around, which is cost, which is tax cuts. Trump made a lot of promises on the tax cut and on the service provision side of things. Yeah, we're going to do this, we're going to do that. You know, whatever came to mind, he would say it, and people started adding it up to $15 trillion. The money has to come from somewhere, even if he does a fraction of what he says. And that comes from having to reduce some programs. And there's a fear that in order to pay for his programs, including the tax cuts, it's going to come from Medicaid, affordable care, tax policy. It's the tax end of it, and I don't have conversance with the real details of it. You really want to get a healthcare economist in to talk about it, but clearly that's where he'll go and where he could get more support. But by and large, it's one of these things where why do I want to get people angry?
Yes,
you know, especially since MAGA world isn't clamoring for it. MAGA world wants more and cheaper care. That's what they want. They don't want to have to wait online at a county health fair for 3 hours to get the kind of care they can't afford because the deductible's too high.
Yeah.
Or a doctor doesn't want to locate because I can't pay them enough. That.
So just to sum this up then, what do you see happening in the new Trump administration within the first 100 days versus what we'll see happen in the first year when it comes to health care and health policy?
Not much of substance.
Okay.
I think you'll hear some happy talk or sad talk about reducing prescription drug prices, about shifting the burden of certain policies from one bucket to another. There's going to be some restrictions, and this may be the first thing, even though they're not going to fundamentally mess with most of Medicaid, they may restrict Medicaid funding for abortion, which they already have they tried that for a certain degree. The policy shifted a bit, and I think that's an area where they may be able to put together some support there. He needs to show his anti-abortion base that he's still with them, that he didn't just take their votes and run. You know, I saw one set of numbers that showed that Trump won the evangelical vote by 65 points. He lost everybody else combined by 18 points. So he's got to deliver for that segment. And he should. I mean, people vote for you like that. You owe them something. But he's got other fish to fry. He's got the whole tariff situation to deal with. He needs to make a show at least. And the federal government, it's not that much on crime. And he specifically has got to deal with immigration in a way that shows his supporters is forceful, at the same time that he has to keep, at least in the back of his mind, that there was a shift. I mean, I think people have made a little too much of it, but there was a shift, particularly among Latino men, and he wants to be a little careful about how far he goes, the harshness of his rhetoric on immigration, that he doesn't alienate the new Asian and Latino voters who have taken a chance on him this time. It's a little complicated. It's not as simple as it always was for him. We didn't care about Latino voters. We didn't care about Asian voters. They didn't support us, right? Well, now they started to.
Yeah.
And that's the scariest thing for Democrats. And their biggest problem is, how do we get these voters back? Yeah. You know? And Trump would be smart politically if he didn't go out of his way to alienate them and make them say, what did we do? Why did we do that? And 2 years later, Congress is Democratic.
Well, what will be interesting to see is what happens in 2 years, but also what will be interesting to see in 1 year. So I would love to have you back.
Sure.
Next year.
If you have 30 seconds, it'll be interesting to see how Trump and MAGA world handles the shooting of the United Healthcare CEO and all the conversations it has spun. over health insurance.
Yeah.
I mean, I'm unfriending people who say, I don't support murder, but. When I see that but, they're gone.
Mm-hmm.
They're gone from my life. But there is a conversation starting now, I use the but myself, that policymakers are going to have to try to get their arms around. Trump, again, has pretty good political instincts, and I'm interested to see what they do about that. You know, and I have no idea.
Yeah, it's going to be really interesting to see how things unfold. But with that said, I would love to have you back next year just to see what happens over the next year. Maybe healthcare, health policy wouldn't be as much of an issue as you speculate. It may not be by the end of next year. So we'll see what happens.
We'll see.
I would love to have you back regardless.
Thank you.
So thank you, Larry Levy, for being here on this episode of The Health Line. My name is Dr. Andrea Alt-Brutus, and we'll see you again next time.